to our maternal health roundtable this evening. This is such an important topic, and I just wanted to give you a little bit of background, and then I'm going to get out the way and let the experts talk. But last summer, Senator Tim Kaine gathered a roundtable of experts and practitioners to discuss the very real issue of maternal mortality. We heard the dire stats of what some folks were experiencing, and we know that there is a disparity as Black pregnant people were around 2.5 times more likely to die while pregnant, during delivery, or up to a year from delivery. And we knew we needed to do something. And these numbers are actually worse in some regions other than, more in some regions than others. And they often point to systemic racism that may be affecting Black health outcomes in a lot of different ways. And so we were investigating that. We talked about the issues, and Senator Kaine got a better understanding of federal legislation that would be needed in order to help the problems. And he's actually working on those bills right now. And later tonight, we're hoping to be joined by Queena Daly that will help answer some of the questions from a federal perspective as she serves as his constituent services representative. But some of the issues we discussed totally were state issues and within the realm of the work that I do in the General Assembly. And we also discussed some needed shifts in cultural understandings to get rid of some stigmas, to get more education out there. So we kept meeting, and that's who we have, a few folks with us tonight that were at that original roundtable that we've been meeting since last summer, so for about a year now. And in the 2020 session, we worked on legislation and budget amendments that would help close the disparities and help more families have healthier outcomes. And because one of our noted needs was public awareness of the issues that were being faced, like I would go to events and I would quote some of the stats, and people literally thought that I was just incorrect because of how much harder this issue is hitting certain communities, but it was true. So one of the actions that we took together was to get House Joint Resolution 111 passed, and it did, and it designates July as Maternal Health Awareness Month in Virginia. So this is the first ever Maternal Health Awareness Month in Virginia, and that's what brings us here this evening. As we close out July, we just wanted to make sure that we had come together to have this discussion. We have several people here with us this evening to discuss maternal health and various aspects. And I want to thank each of them for taking time to talk with us tonight and for all of their hard work every day to make sure that there are indeed healthier outcomes across the Commonwealth. I also want to give a shout out to Delegate LaSharice Aird of Petersburg, my sister, my seatmate. We're going to have an at ease soon, so stay tuned. But she's been working on this issue very hard as well and got some things done within the realm of doulas and doula care. We'll also have an Instagram Live coming up before the month is over to just really sit and talk with a doula or doulas to talk more about their work and really amplify the needed support and the added value that doulas bring to the table. So tonight, we're going to hear more on the updates from the field, resources available in the community, and opportunities for advocacy. And we will also make sure that we try to answer all of your questions. So if you have a general question just about maternal health in general or about something that someone has said, go on and drop it in the comments below, and Tempest will help share those at the end. But if you have a more private question that might have some personal information, at the end, we're going to make sure that you have all of our contact information so that you can reach out to the appropriate person and get the more personalized answers that you may need. So with that, thank you again for being here. We're going to get started, and we're going to go to Dr. Cynthia Romero. She is the director of the Brock Institute for Community and Global Health, associate professor at EVMS, Family and Community Medicine, associate professor with the Masters of Public Health program, and the School of Health Professions with EVMS as well. And so we are going to let Dr. Romero share with us now.
Good evening, everyone, and thank you so much, Delegate Price, for the wonderful introduction, and thank you so much for your leadership in leading this effort, particularly here in Hampton Roads Maternal Health Month. It is a great pleasure to be part of this first kickoff. What I'd like to do is start off by saying that I am only one of many great champions for maternal health at EVMS. And so the slides I'm going to go through very quickly are simply to reflect a snapshot of what's happening to certainly pursue the efforts of addressing maternal health issues and eliminating those health disparities. So starting with maternal health in our clinical work, of course, we have our Eastern Virginia Medical School medical group, and in particular, we have our obstetrics and gynecology department with the Division of Maternal Fetal Medicine. So we are the medical center that actually helps take care of the most sick of the sick moms and infants that are in our region and have the expertise, particularly of several MFM physicians that specialize in the most at-risk moms and pregnancies. We also have other primary care specialties like EVMS internal medicine and EVMS family and community medicine that focus on the health and wellness of women, especially those who are in the childbearing years, and helping them stay as healthy as possible so that when they are pregnant, that they can have the most healthy pregnancies. Also within the realm of clinical work, we have our Healthy Start Loving Steps home visiting program, which is focused on supporting pregnant and parenting families. The goal of this program is to reduce maternal mortality, maternal deaths, reduce infant mortality or infant deaths, and reduce poor birth outcomes. The focus are primarily on the differences or the disparities, particularly for those of color. And this program is available to serve families and pregnant women in Norfolk and Portsmouth. As far as education, EVMS is your workforce generator, particularly for medical specialties in the physician realm, but also in other health professions, such as physician assistants, the art therapy, surgical assistants, masters of public health, and so many other health profession programs. In addition, we also have our residency programs, which are those who've graduated from medical school and are in their 3 to 6 year training programs to be able to be specialized in various fields. So we have resident physicians in obstetrics and gynecology, internal medicine, and family and community medicine. In addition, we also have several aspects of our institution, EVMS, that is involved in community outreach, particularly regarding maternal health and pregnant and parenting women. So starting in our Office of Education, which again includes all of our medical students and health profession students, they are involved in community engagement activities. And in fact, we have community engaged learning focused on the Mothers and Baby Mermaids, which is run out of our OBGYN office, and our Hopes Clinic, which helps serve those who don't have insurance. Minus 9 to 5 is a multidisciplinary collective impact effort, and the work group, Healthy Homes and Healthy Children, actually focus on advocating for universal screening, developmental screening, and safe pathways through pregnancy. And then my institute, the Brock Institute, even during this time of COVID-19, helped work with other stakeholders to develop a resource grid, particularly supporting pregnant and parenting women that are suffering from substance use disorders. And lastly, we do have research projects, particularly around maternal and child health efforts. And in particular, Dr. Tracy Fu works with the data set called the Virginia Pregnancy Risk Assessment Monitoring Data from 2009 to 2018, and she's able to explore various aspects of pregnancy, looking at birth outcomes, and trying to see what some disparities are and what the sources are. In particular, they're going to be highlighting unmet needs of long-acting reversible contraception in Virginia mothers with unintended pregnancy at a national conference in October. And then lastly, the Division of Community Health and Research, also with Dr. Fu and several others across EVMS, are involved in a school-based comprehensive sexual education program called Get Real. And you see there it's in partnership with the Norfolk Department of Public Health, as well as the Norfolk Public Schools, to reach middle and high school students, to reduce teen pregnancies, improve sexual health outcomes, as well as academic outcomes, and focusing on healthy relationships and decision-making, and using the relationships with parents and primary caring adults as sexual educators. So I will be more than happy to answer some of the additional questions you may have at the end of this panel. So again, it is my great pleasure to be part of this panel. And again, I appreciate Dr. Price or Delegate Price for including me in this wonderful event. Thank you.
Absolutely. And Dr. Romero, just before we conclude your part, I'm going to put you on the spot and ask a question.
Sure.
What's the most rewarding part of your job?
Oh my goodness. I would say the most rewarding part of my job is to see the people that we are privileged to serve actually get better and have the opportunity to say that by partnerships across our community and working with all stakeholders, that their lives are better because of the cooperative efforts that we have. Thank you so much for asking.
That's awesome. Well, thank you again for all that you do, and we're glad that you can stick around for some questions.
Of course.
And so now we're going to go to Jenny Corley, who is with Smart Beginnings. Jenny, take it away.
Okay, once again, thank you for having me. I'm so glad to have this chance to share our Smart Beginnings Prenatal Universal Screen program. When I say universal screen, it's definitely a different type of universal screen than what Dr. Romero was talking about. So in 5 minutes, I'm going to give you a quick rundown of what we do. Back in 2013, Smart Beginnings was awarded a Virginia Department of Health McV Maternal Infant Early Childhood Home Visiting Grant. And our grant specifically targets pregnant women in Hampton and Newport News in an effort to connect them with programs and resources beginning prenatally. Prior to that, most women were getting resources after the baby was born. And there's just no disputing that having the resources to promote a healthy pregnancy and to be better prepared to parent enhances positive birth outcomes and early parenting experiences. The objective of our prenatal screen is to connect with and screen as many women as possible. We really feel that all women should be screened and not just those that present with obvious risk factors. It's not possible to tell if a woman has risk factors just by looking at her. Even those that are well educated with private insurance and they have a good income, many of those could have risk factors that could impact their maternal health and that of the baby. And busy medical providers don't have the luxury of time it takes to discuss all the possible resources out there in our community. But fortunately, our team has the time it takes to talk with and listen to our clients. We do all of our screens via telephone conversation, and that really does work. And we do it at a time that's convenient for the client, be it evenings, weekends, holidays, whenever they will let us call, we'll call. And the screen consists of questions related to demographics, socioeconomics, maternal health history, as well as behavioral and emotional health. Once the conversation and the screen's complete, we discuss appropriate referrals and recommended resources and referrals with them. However, we never send a referral containing their contact information without their verbal authorization. Every time we screen someone, we follow up with an email, a text, or even a letter outlining all the resources discussed and all the referrals that we're making on their behalf. And we do this so that during the conversation, they don't have to remember names, numbers, they don't have to write anything down. We're going to provide that for them at the end of the phone call. We also include in that email some reliable websites for information that maybe we haven't really gone over with them, but we know they're going to be useful if they look those up. And they're always related to pregnancy, infancy, and early childhood. So you might be wondering, where do we get all these women that we're going to screen? Currently, there are 15 consistent sources that send us consent forms that a woman has filled in. Most of them are OB practices here on the peninsula. We have 2 hospital emergency departments, WIC programs, and a few other places where we get a smattering where they serve pregnant women. There's a form that I have in all of those different places, and each one has designated where it's coming from, so I know exactly where it came from. And a woman will fill it in with her contact information. They'll fax it to me, and it needs to be done that day. If they put it in a bag to go home, we'll never see it. But if they do it at their first prenatal visit with all their other forms, fax it to me, enter it in a database, and then I send it out to one of our prenatal resource specialists to make the call. Now, because our funding is the McV for home visiting, one of our main goals is to screen and refer to home visiting programs. And you saw in the previous slides from Dr. Romero, home visiting programs offer guidance on having a healthy pregnancy, emotional support, reducing the incidence of abuse and neglect, and so much more, all using evidence-based curriculums. They work closely following families, equipping them with resources and tools that they need to get their children off to the best possible start in life. Now, some women we screen don't have risk factors for referral for home visiting, and there's some women who do, but they refuse to be referred. But we want to make sure that, we give them the same good resources that we're going to give to those that we do refer to home visiting. Routinely, we refer to the WIC program, the health department's car safety seat program, a variety of parenting, childbirth education, fatherhood initiatives, and as well as behavioral health resources. There's just a whole bunch of places we try to connect them with. One thing to keep in mind, though, is that, excuse me, we're a screening program, and we're not case managers, and we don't follow these cases. If we get a call back, we'll follow up with them. If we have any concerns that have come up, we'll talk to them again. But it's not somebody we're going to follow throughout their pregnancy like the home visiting programs do. We don't have all the answers, but we do know where to send our clients for answers and for more information. So trying to connect them with the right places. Now, since our grant started in 2013, we screened and provided resources to about 8,500 women. And last year, it was about 1,600 women that we were able to screen and provide resources. Of the total number, 8,500, we've referred over 5,200 to home visiting programs. And we do all that with a very small staff of 5 part-time people, some very, very part-time. Everybody on our staff is really invested in maternal health. We all have a background in maternal health. And so, we really take pride in what we do. So that's a quick overview of our program. I'd be happy to share more information with anyone who may be interested, because that really was a really quick overview. But feel free to visit our website at www.smartbeginningsvp, as in Virginia Peninsula.org, because the screening program that we have prenatally is just a small piece of the Smart Beginnings Virginia Peninsula pie. There's a lot more that goes on at Smart Beginnings. So thank you.
And Ms. Coyley, you can answer now or maybe later, because I, again, am putting you on the spot, but did you want to highlight what some of those other parts of the pie are at Smart Beginnings?
And I have time to do that?
Yes.
Okay, well, I'll just name a few. One is the Virginia Quality Program, which is a voluntary program that works with child care providers, whether they're in-home or center-based. I'm not an expert on it, but I do know that they provide them with a lot of education, a lot of support, a lot of guidance, and they will even support them with materials they need to go above and beyond, there are different levels that they can achieve being higher than what's required of daycare, childcare facilities. There's a childcare resource and referral program. A mom who needs childcare can call. She can say where geographically she needs childcare, what hours. She can find out if it's a program that does subsidy, and our referral specialist can plug that all in and give that mom a list of places that will meet her criteria. And they're keeping all of this up to date, even during the COVID crisis. There's the behavioral support team that works with centers. They're under Virginia Quality, but they're a whole separate entity. They work with the centers on how to manage behavioral health issues with the children that may be a problem. I'm probably not saying this like they would, but in an effort to make sure that that child can stay in that classroom, and that, you know, everybody can continue to learn. And they're trying to equip the staff to be able to handle that within the facility. And there's still other things, but those are some of the main ones that come to mind, but they're all on the website.
Awesome. And are there any issues that you find that might be obstacles to successful home visits, or are there any stigmas or anything that really might get in the way of a really good home visit program?
I'm probably not the best one to answer that because I don't do home visits, but I think some people don't have it's not their home. They're not allowed to have somebody come in, or it is their home and they feel like they don't want any intrusions into their house, that they'll be judged, and that concerns them. They're worried somebody might see something and report them to CPS. Schedules are hard. You know, so many people are working, so they don't have a good time for somebody to come in and visit. And I'll say that I have heard that with doing virtual visits during the pandemic, a lot of people are accepting the virtual visits. So, but it'd be great if you wanted to contact the home visiting, they could probably give you tons more information.
Awesome. Thank you so much. And also thank you for sticking around for some questions at the end in case there are any for your area. Next, we are going to go to Becky Bowers-Lanier, who is with B2L Consulting, and she represents midwives. So tell us some more about midwives and the work that you all do.
Sure. Thank you, Delegate Price. And to the intrepid Tempest, who's quiet on the line, thank you for the work that you've done in pulling us all together, and also Delegate Price for the passage of HJ 111. I work with the Virginia Midwives Alliance, which is an organization composed of midwives, midwifery students, and midwifery advocates and consumers. We're committed to excellence in midwifery care and promoting healthy prenatal care and normal births in all settings available to mothers and babies. Midwives create partnerships of care with their pregnant clients, provide information and recommendations to foster respect and trust, and minimize interventions during the laboring and birthing process. We refer women to obstetrical care when needed. Years ago, midwives were the primary birthing providers to all women, and they still are in many parts of the world. In the African American community, midwifery care was predominant until the mid-1900s. Most African American midwives retired, and we are now working to invite more African American women into midwifery. We're looking particularly into the doula community with which we work. Women of color should have meaningful options regarding where, how, and with whom they will give birth. Additionally, all should expect respectful, person-centered, anti-racist models of care. Data indicate that preventable maternal mortality is associated with multiple forms of discrimination, as we heard Dr. Romero talking. and that maternal outcomes are improved by the use of midwives, doulas, and home visitor programs. The members of the Virginia Midwives Alliance seek to work collaboratively with our physician colleagues, with doulas and other perinatal support services, and including home visitors, to achieve full integration into maternity care. That's it. Thank you. I look forward to continuing to work with you.
Yes, thank you. So just a quick question, and I know that
Sure.
you are working on behalf of them as opposed to an actual midwife yourself, which is
That
great.
is correct.
But can you tell us more about the work that you do in Richmond as it pertains to advocating on their behalf?
Sure. Well, first of all, I have to tell you, I am a nurse. I've been a nurse for a long time. When I was having my babies, I wanted to have midwives, but there weren't many midwives around, and there's still not many midwives in the Commonwealth. There are about 80 licensed midwives. These are midwives who provide out-of-hospital and home births in particular. And then there are about 400 or so nurse midwives in the Commonwealth, not many. But I became interested in midwives because of my interest in midwifery from a long time ago. My dad and mom were delivered by midwives at home. My husband was delivered by a midwife in his home. He's African American, and that was very common in those days. So I fell into midwifery representing them because of that interest, and I have worked with them for 16 years, as a matter of fact. What I do in my job is to advocate and to get in front of people like Delegate Price and talk about midwives and ask for things for them. Right now, we're working really hard on Medicaid. Many of our clients are Medicaid recipients, and we have some obstacles really to their being able to access care by midwives and stay in managed care. So that's one issue that we're working on. So I work as a voice for the midwives. They're very vocal themselves, and their clients are very vocal. And I serve particularly as a pest.
Well, I definitely would use another term. It's been great working with you and just working to elevate the work of midwives and doulas, but also the concerns as, you know, they're trying to get paid for the hard work that they're doing, respect within the actual community for the work that they're doing. But you're a really good voice for them to have in Richmond. So thank you.
Thank you.
Thank you for being here tonight.
Sure.
And next, we're going to try Dr. Jacqueline Jones again. You know, with COVID and everything that's going on, we just have to roll with some tech issues. But Dr. Jacqueline Jones is the Family Maternity Center Manager for Centera Careplex. Dr. Jones? Yes.
Oh, great.
But we can't see you.
I know, right?
But that's okay. Just keep going. No, there it is.
Yeah.
We see you.
Oh, I am.
Yes.
I apologize. It is Monday, and so I'm going to, I don't know how to take it off my phone. I hope you don't hear any flashback from my phone in my office as well as my cell phone. I'm doing both. So can you hear me okay now?
Yep, that sounds great.
Okay. Again, good afternoon, ladies. I apologize for all the technical trouble we're having. But my name is Dr. Jackie Jones. I do represent the Family Maternity Center here at Centera Careplex Hospital. I'm going to hang it up from my office phone so I won't get that. And so I want to share with you, you know, we've been here about 2.5 years now. We opened back up in 2018. So we have been fiercely working to reacclimate ourselves in the community and have more babies here in Hampton, Virginia. So we're really excited. We have a couple of partnerships that we've been able to align ourselves with as we continue to work with the community. One of the partnerships we do have is with Healthy Families. And some of you may know Healthy Families Services, Hampton and Newport News residents. And what they do is that they provide services to mom when they get discharged. They do newborn care, they do family bonding. They work to help with disparities in the community with immunizations and just any type of health issues the patients may have. And the partnership we have with them is that we allow them to come into the hospital and see the patients before they go home and try and get them connected before they leave. Because sometimes once the mom is discharged, it's hard to get them connected to services in the community. So we have been able to work with them and allow them to come into the hospitals and get moms signed up and tell them all about what they can do for them and support them with upon discharge. And so that is the Healthy Families Partnership that we have, that we're really excited to get that partnership going again once we came back into the area. Another partnership we have that I'm really excited about is a new one. It's called Stork's Nest, and that partnership is with the March of Dimes Foundation as well as the Zeta Phi Beta Sorority Incorporated. And what they do is that they have an incentive-based program for prenatal promotion for pregnant women. And what they do is they provide an incentivized program for moms to come in and get their continue to get their prenatal care. They give prenatal care education and all kinds of activities that promote health and well-being for the moms. With this incentivized program, the patients earn points. And our partnership with them is that we provide the store for their goods, where the patients can come and shop for the points that they've earned. It's almost, I equate it to a Chuck E. Cheese system, whereby you gain these points and you come in, you can buy anything for your baby from Pampers. You can get onesies, they have strollers, they have car seats. And once you've earned your points, you can come in and shop for those items. So that's one of the things, we connect ourselves to the community. They do offer a curriculum of classes for prenatal classes, and we help support that by allowing them to teach the classes on our maternity unit, as well as sometimes our educators will help in teaching those classes for the moms. Another partnership we have that's really important is mental health, as we talk about Maternal Awareness Month, and mental health is really important. And we aligned ourselves with Postpartum Support of Virginia. And what we do with them is that we offer twice a month, the first and third Tuesday of every month, we will offer a support group for postpartum anxiety and depression. What I love about this program is that it's free for moms. They can come antenatally, intrapartumly, and they can come postpartum for up to 1 year. And they can bring a newborn infant, so they don't have to worry about trying to find childcare during the time that they're coming to the class. And my staff supports the class by helping teach the class. They have therapists and psychiatrists to come and teach this class as well. So it's a really good alliance that we have for the community, where you can come and be with other moms who may have the same issues you have. Once you have that baby and go home, things are very different than they were in the hospital. So that's the extension of support that we can offer to the community once a mom goes home. One last program that I really like that we have when we talk about maternal health, sometimes everyone doesn't have a great outcome. And so we have aligned ourselves with Park Lawn Funeral Services. And what we do, we have a perinatal loss program. And every December, we will have a special celebration for those parents who had a perinatal loss throughout the year. And so this has been very successful for us to engage those moms as well, to want to leave out any of our patients and anyone in the community that needs that type of support. So again, I'm glad I got to share those 4 programs with you. As an inpatient entity, sometimes our outreach is sometimes limited, but we really try and extend ourselves to make sure that we're touching all of those in the community, as Centera always does, and reaching out and seeing what kind of support we can provide our patients. Thank you, Delegate Price, for all that you do. Thank you for this bill, and we're really excited about it, and every year hope to help support it in any way we can. Thank you. Sorry about all the technical difficulties.
No, and wait, before you go, Dr. Jones, thank you so much for that information. And I'm going to put you on the spot as well.
Yeah.
What is one piece of advice that you wish more pregnant people knew prior to delivery?
I wish they knew that care can be free, that you don't always have to have money to go seek care. You just have to find those resources in the community. Most people will have a free clinic. Hampton has quite a few. And I wish that more people knew that and would not wait to get prenatal care because they're worried about being able to pay for that. While that is a real issue, there are opportunities where you can get care, some sort of care. So that's one thing I wish people would take the chance and seek those opportunities, and don't be embarrassed because you don't have insurance, because the baby's life and mom's life depend on it.
Awesome. Thank you so much. And if
Absolutely.
you can, stick around for questions.
Absolutely.
And next, we're going to hear from Michelle Wooten McFarland, and she's the organizing manager at NARAL Pro-Choice Virginia. Michelle, you there?
Yes, I'm here. Thank you so much, Delegate Price, for having this roundtable, and thank you, Tempest, for crowding us all into one space, emailing us and getting us together. My name is Michelle Wooten McFarland, and I'm the organizing manager with NARAL. And I'm so thankful to be in this space because being around providers and hearing all the great things they're doing on the ground is really awesome. Part of my job is we do issue saliency, and we advocate for reproductive health care. And so maternal health is one of those. We advocate for Black maternal health, not just on the legislative side, but also the community-based as well. And so one of the things we talk about when we talk about Black maternal health, we talk about the racial disparities and why this is so. And what we do in our culture change work is we talk with providers on the ground, and we have these working relationships with culturally competent providers to help build and bridge these gaps, because a lot of folks that I've had conversations with in my programming when talking about this issue talks about how they felt uncomfortable or how they've had really bad experiences seeking maternity health care. And some of them have been near fatal for them or for their newborn, their baby. And so in having these conversations and having these discussions and people telling me their experiences, I was like, we have to figure out a way to bring providers and patients in the room and see if we can figure out how to bring about culturally competent programming to providers to help them understand this is needed, especially in the Black community, amongst young people who are pregnant. And so working with Students for Choice at EVMS, they're not providers yet, but they're our future and they're incredible. Working with various different providers across the state has been really awesome. Also, under the leadership of the Doula Project and our coalition, the Virginia Repro Coalition, underneath the leadership of the Doula Project and Breath and Color, really being these like incredible forces out in Virginia, out in Richmond, has really helped us in guiding our advocacy as well. So the programming that we do, like I said, we do discussion panels. We are also in action trying to figure out ways to support our doulas on the ground, especially in this time of COVID. So putting together care packages. So that's what we're working on right now, because it's unfortunate a lot of folks can't get to their clients. So trying to figure out ways to make their lives a little bit easier, or maybe their clients' lives a little bit easier. So that's something that we've been working on, as well as supporting and uplifting our clinics, like Planned Parenthood and Whole Women's Health. So that's it on my end. I know that there's discussion about special session, and what is and what's going to happen in special session. Our legislative agenda at the top for us and our organization is Black maternal health. So really trying to figure out where and how we can help, and looking to our leaders on the ground for that. And so as session draws close, we'll definitely have that policy agenda drafted up. And I'm assuming Delegate Price will be more than happy to tell us of any work that incredible work that she's doing to further this issue and move it along.
And Michelle, I'm going to ask you a very frank question.
Okay.
You know, some people are looking like, wait, pro-choice, they were all pro-choice. What are you doing as a part of this conversation? Can you speak more about your organization's mission in general, and, you know, maybe to some of the misconceptions about why are you all involved in maternal health work?
Sure. So I think a lot of people think pro-choice is abortion only, and that's not what repro health is. Repro health is a spectrum. It's abortion care, it's birth control access, and it's also ensuring that pregnant people have, you know, rights, and that they're able to have healthy pregnancies and have healthy outcomes and raise healthy families. And so our mission and goal is always to fight for people who are in need of reproductive health care services. And this is something that is affecting so many people across, especially Black people who want to be pregnant or are choosing to be pregnant. It's affecting them across Hampton Roads and Richmond in particular. And so we have to be in this fight along with our leaders, and we have to see how we can help in any way we can in any capacity. And though we are more of a, you know, a wonky like legislative advocacy group, what we do on the ground is definitely more education, and it's more community. And our programming has always been the programming that tried to reach across very diverse communities to ensure that reproductive health care is accessible to all Virginians, not just a certain group.
Awesome, thank you. And it's been really great working with you and the other partners that sit at the Repro Health table in justice with you, and working with you all on the Reproductive Health Equity Act. So that is in the middle of being in a study in a subcommittee for the Health, Welfare, and Institutions Committee. So we'll continue work on that as well. And thank you as well for sticking around and answering some questions. Next, we're going to go to Angela Futrell. She is the Chief Executive Officer at Southeastern Virginia Health System. Ms. Futrell, are you there?
I am. Good evening. How's everyone?
Awesome. Are you able to turn your video on?
How
There you
about that?
go. Hey there.
Hi, how are
Go
you?
for it.
So you'd like me to talk about Southeastern Virginia Health System in terms of prenatal services. So we are, as I fondly like to say, the federally qualified health center in the room. So it is our part of our mission to provide comprehensive health services to everyone, regardless of whether they are insured, uninsured, or underinsured. We confirm the pregnancies for our clients. We have 15 localities or 15 sites, 2 of which are dental, and the remainder are primary care sites or healthcare delivery sites, as we like to call them. So within those sites, we would confirm the pregnancies for our clients and refer them out, with the exception of our Chesapeake office. At our Chesapeake office, we do provide comprehensive prenatal services there, where the clients are, the pregnancies are confirmed, and the OBGYN doctor sees them there, and then on to delivery. And then once they deliver, they're back for the postpartum care, and then we will follow the babies as well with regards to pediatrics. So again, that is our mission, to provide the comprehensive services to our clients, to include the delivery of prenatal care for our clients.
Ms. Futrell, what's something that some of your clients come in that they didn't know that you wish they would have known before they got there?
I think I have to say ditto to what everyone else has said, and what you said is that that they could get prenatal services without having insurance, or that they delayed entry into prenatal care because they were uninsured. So, you know, we always want to tell anyone, moms, don't delay your prenatal care. Don't, you know you're pregnant, especially moms that are not first-time moms. They know they're pregnant. They think they understand what's going to happen. We still want you to enter into care in that first trimester, so that you, as well as the baby, gets off to a solid start during the pregnancy. So don't deny your care because you're uninsured. Please come in and let us get you started in your prenatal care.
And then I know that, you and I have been speaking about just the wellness and wholeness of the person prior to and after the pregnancy. Can you tell us a little bit more about other services that you all offer at Southeastern Virginia Health System?
As I said, of course, the primary health care services, because we're very concerned about preventive services. We want everyone to have a primary care home and a primary care provider. So we want everybody to get routine checkups. Unfortunately, we have to do much more chronic disease management and episodic or acute care than we would like to do. We would like to provide more of the preventive services. So we want to get folks in on a timely basis. We push the well woman exams every day, day in and day out. We want the ladies to come in and get their annual checkup. I know things have changed with regards to pap smears and when you need one and when you don't, but still, just to touch base and make sure you're doing your breast exams, make sure you're getting all of your well woman components done as it needs to be done. And of course, we have pediatric services. We do have 2 dental programs, and we provide, all of the what we like to call enabling services or support services, the nutritional counseling, behavioral health services. We have a wonderful, our pharmacy assistance program, whereby clients who don't have the money and through the pharmaceutical programs, if they're eligible, they can receive all of their medications free of charge. Also, that we do a lot of outreach with our staff. Each site has an outreach person located within the site, and that person helps not only with Medicaid enrollment, marketplace enrollment, but just outreaching to the community to get the word out about prevention. Of course, right now we're really inundated with COVID, just, keeping people informed. We did a mass screening on last Monday, the 20th, and we screened about 187 individuals. So again, another focus for us is just the health disparities that exist among the races, the genders. Unfortunately, African-American folks are at risk for most things more than other races. And so we're working just to tell folks, be informed, stay up to date with your wellness exams.
Thank you so much. And we hope that you can stay to help answer some questions as well. And our last speaker for the evening is Ashley Kenneth. She's the Senior Vice President of Policy and Legislative Affairs with the Commonwealth Institute. Ashley?
Good evening, and thank you so much, Delegate Price, for this opportunity. It's amazing to be among so many amazing women who are doing such awesome things across the Commonwealth. Again, my name is Ashley Kenneth. I'm the Senior Vice President for Policy and Legislative Affairs at the Commonwealth Institute. We are a nonprofit that does policy research, analysis, and advocacy with the goal of changing the narrative and ensuring that people with low and moderate incomes across Virginia, as well as people of color, have the opportunities and the resources needed to thrive. As we think about maternal health, it's important to acknowledge, as so many have said, that there are significant disparities by race in regards to maternal mortality, and there are policy choices that lawmakers can make to help eradicate these disparities. Black women are nearly 2 times more likely to die during or as a result of pregnancy than white women in Virginia. And there are several contributing factors for why this is the case. Black women face a myriad of systemic issues, including racism and sexism, that impact opportunity and daily life, including interactions that Black women may have with the healthcare system. Decades of deliberate policy choices have built significant barriers to opportunity. For example, there's a significant pay gap between Black women and white men. Black women typically earn 60 cents to every dollar that a white man makes in Virginia. And nationally, Black women were paid 21% less than white women in 2017. Less income often results in less opportunity, and therefore the need to make difficult spending decisions in order to support a family. And as Becky alluded to earlier, Black women report high levels of discrimination in the healthcare setting. There are studies that have shown that implicit bias of many medical professionals has a negative impact on the quality of the healthcare received by Black people. A recent study found that 32% of Black women said they personally have been discriminated against because of race when going to a doctor or to a health clinic, while 22% have avoided it altogether because of the fear of being racially discriminated against. Last year, Governor Northam announced a goal to eradicate the disparity in maternal mortality by 2025. And there are actions that lawmakers can take to deliberately work toward that goal. In just a few weeks, legislators will reconvene for a special session to finalize the state budget. In April, all new spending was put on hold until we had a better handle on the economic impact of the pandemic. And now legislators will need to make a lot of tough decisions about what to prioritize in their funding. The state budget reflects our priorities and ultimately who and what we value as a state. These decisions about funding are critical, and legislators need to hear from their constituents about what should be the focus. 2 decisions that lawmakers can make regarding maternal health are to re-allot funding in the budget to extend Medicaid coverage for pregnant women to 1 year after pregnancy, as opposed to the current 60 days. Research has shown that risks can often extend long after 2 months of giving birth. And lawmakers can also fund home visiting services for new mothers, which, as Ms. Corley mentioned earlier, promote health benefits such as healthy birth outcomes and often result in enhanced school readiness, less child abuse, and more family self-sufficiency. Outside of the budget, decision makers can help facilitate the diversification of the medical field and mandate regular racial bias, education, and training focused on patient-centered care. Lawmakers should study the potential impact of a policy by using a racial equity impact assessment tool before policies are enacted. We can establish a paid family and medical leave program in the state so that women can take the needed time off from work after childbirth and not have to worry about their financial security. And of course, we need to fully address the social determinants of health and various inequities in education, housing, transportation, food access, et cetera, and strengthen opportunities for economic prosperity. The pandemic and the economic downturn have brought to light how interconnected so many of these issues are. In fact, there was an article just today in the Roanoke Times that mentioned a Black woman who was pregnant. She left her job in healthcare to avoid exposure to the virus, but now has no income. And she's struggling to gain unemployment insurance and to pay her bills, and her baby is due soon. So anxiety is high, and this woman could be at risk of losing her housing if she can't pay her rent. So we need to continue advocating on a number of fronts during this time, but we must not forget that we need to ensure Black women have the resources and the opportunities to safely survive pregnancy and childbirth, as well as the resources to financially support themselves and their family during this time of COVID and beyond. TCI has published a number of blogs on racial disparities in maternal mortality. So if you are interested in learning more, please feel free to check out our website, thecommonwealthinstitute.org, or you can connect directly to our blog, which is thehalfsheet.org. Thank you.
Awesome. Thank you so much, Ashley. And again, I'm going to put you on the spot as well, but I know that you can handle it. So one of the things that you said is really important, and especially as we're looking at the special session, the shortfall is not as much as some of the earlier projections, but it still is a shortfall. So there are going to be some things that we have to do, cuts, but also creative ways of funding other things so that we can get to a balanced budget, because we do have a mandate to have a balanced budget, unlike the federal government. But you're talking about the different things that are connected. So can you talk about the complexity of this issue as it might pertain to, you know, intersectional issues for Black women, but what might complicate, you know, just, it's not just this one thing or this one other thing, but why you have to fight holistically for Black women's lives? And or talk about some of the other things that you all are looking at within this interconnected realm as it pertains to the special session in the budget. So I tried to be broad so that you could go wherever you wanted to, but just say more things.
Yes, thank you. I mean, it is beyond time to make sure that Black women have the opportunities and the resources needed to survive, period, but to survive childbirth in particular, since that's the focus of today's conversation. As you mentioned, Black women live at the intersection of racism and sexism, and so there are so many issues that affect Black women in their daily life. And it's important that we address all of those issues in order to make a real difference in folks' lives. And so that means making sure that folks have the income necessary to pay their bills, that they have the housing and the housing supports necessary to keep their families safe and protected, that they have access to safe food and transportation. All of these issues are certainly interconnected. And there are so many issues that the General Assembly considered during this past legislative session and actually chose to fund in the budget. I mean, this was one of the most progressive budgets that I've seen in some time, and it's unfortunate that the pandemic has put a lot of that new spending on hold. But now that we have a better sense of what the economic outlook is going to be, there is an opportunity for legislators to go back and re-allot a lot of that spending. So much of, again, was such major wins like funding for education, funding for increasing TANF cash assistance, making sure that immigrants don't have to wait 10 years before they qualify for Medicaid. All of these are such critical issues that need to be addressed, especially during this time of COVID, when so much has come to light in terms of the inequities that are already existing in our society. We have an opportunity this summer to address some of those inequities and put Virginia on the right track.
Awesome, thank you, and hopefully you can stay around for some questions as well. I think we have a few. I just wanted to offer just a few quick remarks when it comes to the advocacy piece. And so you've heard some folks bring up issues that they are working on in their daily work. And then so from my perspective, special session will start on August 18th. And as of right now, we're talking about the ideas that we think that we will discuss, but until that resolution is passed that really sets the parameters, we are thinking that it's going to be the budget, it's going to be police reform and criminal justice reform, and some of the emergency type issues that are needed under COVID-19. And so if you think that this is an important issue, then you need to make sure that your legislators, your delegate, your senator, if that's me, I still want to hear from you. Just because I'm having this event and just because you know that I know that it's important doesn't mean that I don't want to hear from you. I do want to hear from you because you might have a lived experience that speaks to an issue that helps illuminate why this is so important. Or you may have a perspective that I hadn't thought of or hadn't heard of before. So don't assume that your legislator is already on board knowing how important this is. So reach out to your delegate, your senator, but then also the executive branch under the leadership of the governor has a large role in the budget making process as well. And so it's really important that you reach out to those people. If you have any questions about how to do that, we can definitely get you answers on that. But the other thing is, I'll say, follow the social media pages of the folks that are on this call. They put out great information, and a simple share, like, comment really helps them get the information out there. And you may be able to learn new things too, and about new opportunities, availability, and especially those services that are available. And then maybe get involved with an organization that actually does the outreach work so that you can make sure that this information is getting out. Before COVID, it was kind of easy to, stand out in front of a grocery store and pass out flyers, or, go to the club and while people are in line, hand out pamphlets. And it's really harder now for a lot of this to be digital. So each of us on this call really just need help pumping out the information into the community, because somebody might follow you that doesn't follow me, and then they can see it in your page. Y'all know how social media works. I don't have to tell you, but it's really important. And then we'll have a recording of this available as well in our email update and on our social media pages. And so that can be shared. But now I'm gonna go to the full group. And so if you guys could come on video so that we could answer some of the questions, that would be great. And we're gonna go to Tempest to ask us our first question.
Good evening, everybody. So the first question is, do any of you work with volunteers? And this is for those that are watching that may want to get more involved.
I do. But that's our bread and butter. So we work with volunteers. It's very difficult, like Delegate Price had to try to recruit folks, because right now we have switched from being in-person organizers to digital. We've been digital organizers for the last 4 months, but a lot of our programming now is online, and so it's more accessible to folks, and we can reach more people across the regions. So if you do want to volunteer with us, like I said, we do have programming coming up. I'm doing a program on environmental justice and repro health, maternal health care. So that's coming up later on next month. And we are doing care packages for doulas and trying to figure out ways to support the work that doulas are doing on the ground. So we are doing things. It's just not in person, but you can go to narawva.org, and please do reach out to me, Michelle, at narawva.org as well.
Anyone else use volunteers? So I'll pitch volunteers. We could use some volunteers that are willing to write postcards, write letters, send emails, and really advocate on behalf of some of the issues, like I said, that you all think are really important. We're also making phone calls into areas where a lot of information doesn't necessarily get, to make sure that everyone has the resources that they need to get through the pandemic safely, in a healthy way and in their home. So really trying to get some resources out to prevent evictions. So that is something that we're working on. Awesome. So Tempest, what's the next question?
Okay, so the next question is, are there any new things that we are doing in the maternal health field around the pandemic that you hope might stay in place?
May I answer?
Yes, please.
Well, the midwives are using telehealth now to make visits, and I see Dr. Romero is shaking her head too. And that has been a huge help for them because it helps to keep them safe, it helps to keep their clients safe. And they've found, since many of my midwives work in rural areas where they travel to get to patients' homes where they do their care, they can take more time to work with the clients rather than traveling. So we hope that telehealth virtual home visitations will be able to continue after we get rid of this virus.
Yes, and thank you, Becky. You know, and first, Delegate Price, I just want to make an observation that we all love men, but man, look at all the women that are doing fantastic. I feel so humbled, and just listening to everybody give their presentations, you all, I'm like virtual hug. So again, Delegate Price, Tempest, thank you so much. I truly am humbled to be part of this conversation and with these women. But I just want to underscore what Becky has said. But in addition to continuing the telehealth and definitely home visiting, I want to say it's also at the level to make it equitable for the care, because I think, you know, in this day and age and in the foreseeable near future, you know, the virtual conversations and encounters are really going to keep everyone safe. And I think the idea of helping support and pay for telehealth and all the home visiting supports is really going to be critical moving forward. And I understand that there are several payer programs in Virginia that were enacted emergently for COVID-19 are set to sunset in the near future. And so I just think we need to advocate within Virginia, and certainly, you know, if there are any strategies to help advocate at the national level for the payers there, that this is a critical time to assure that especially pregnant and parenting moms continue to get the coverage and support that they need.
I'd like to just tag on to one thing Dr. Romero was saying. As she was talking, I recalled, and Delegate Price, this really is for you. We are working on broadband, but broadband is a huge issue, not just in rural areas, but in urban areas, and especially when it comes to being able to pay for broadband in the home. And so I hope that there will be discussions around this. I know that the governor has a coalition of that's a private-public partnership to increase broadband access. But again, that telehealth that uses visual, like we are doing now, is preferable to just telehealth that uses telephones. And so we really need to encourage the introduction and use of broadband as widely as we can.
And I just wanted to tack on to what Becky was saying about the access to broadband, because as Ashley probably knows, as they work on several issues, that's also coming up in the education conversations as well, as we're thinking about either hybrid or electronic classrooms. If I have a Chromebook, but I don't have a way to connect the Chromebook, I don't get, you know, the same lessons. And then trying to find outside sources, the answer is not driving to a parking lot and sitting in a parking lot for hours upon hours for a hotspot. We've got to do better than that. And so that is an issue that both urban and rural areas are trying to figure out, and I would say have to be priority for a multitude of reasons, under which telehealth would help as well. And so just so you guys know, if it's like, in case you don't know, telehealth, just like Becky said, it's like this. It's just like maybe like a Zoom or FaceTime or something that is a way for a practitioner to speak to a patient or a client with video and sound, but not having to be face-to-face, which, as was mentioned, is safer. But even before the pandemic, we were moving into that in a lot of different fields so that the areas that may not have this certain specialty or access to a type of practitioner can still get those resources and get, you know, that interaction. I know that I had talked about this earlier, but I got sick after Reconvene, and I was not leaving my house because I wasn't sure at that point if it was COVID or not, but I spoke with my doctor over Microsoft Teams. And it literally was like a work meeting, and he was like, you know, open your mouth. And it was literally like, you know, I was in the office, except for he couldn't touch me, but he was able to diagnose some of the things that were going on just off that video conference. And so it may sound weird, but it's really, really helpful to be available even after the pandemic. And I think in a multitude more of fields and specialties.
Mm-hmm. One thing that I might add, and again, I apologize if I'm interrupting others from jumping in, but one thing that I think we've learned from this pandemic, from observation, but also hearing some of the initial studies that are taking place across the country, is that we've understood now that even before COVID-19, that most at-risk populations will receive information differently than some of the mainstream. So not everyone is watching the news, not everyone is paying attention to their smartphone. So what I have observed particularly is how many different sectors have come together to try to identify the best ways to communicate and to share information with the communities that need the information the most. And of course, we're thinking about, around EVMS, we have good relationships with several of our public housing communities, specifically Norfolk and Portsmouth. And what we've been able to do is consider what is it from CDC and the Virginia Department of Health that they have not heard about. And so we've been able to, pull down the different infographics, print them out, and, kind of distribute them through the housing authorities so that they can get information and understand by the infographics. But I think what I want to get at is, the idea of team. And that's what I really get from this conversation is each of us have really been supporting these pregnant women and their families because of each of the different pieces and perspectives that we bring together. But I think moving forward, as it comes down to, how do we leverage the reach that each of us have and have the information being relayed consistently, just like what many of you all have said already. I think there's so much that we can advocate for. The consistent information, simple, straightforward, and just consistent across the boards could really only benefit the people that we're trying to serve. So just a quick observation there.
All right, thank you so much for that.
Tempest, I'm sorry, hold on one second. And then I would also say, Dr. Romero, making sure that those simple resources are available in the languages that they're needed across the Commonwealth, because that's one of the things that we were working on for emergency preparedness. If you put everything out in English, that's just not cutting it now in 2020. Really realizing who we are as the Commonwealth and making sure that people have the resources in their easiest language for them to comprehend the information.
Agreed.
All right, perfect. So Dr. Jones, this question came up during your presentations in regards to healthy families. And the question is this service available to mothers who choose home birth?
Can you hear me now?
Yes.
Yes.
Okay. So yes, it is available to moms who do home birth. They just won't get the services that they won't come into the home, but they can reach out to healthy families through their website and connect with them that way. But it doesn't matter where you deliver, the services are still available to all members of the community.
Thank you. All right, the next question is, we hear a lot from moms that their symptoms aren't taken seriously by physicians and other healthcare providers. We also hear that women feel intimidated and unimportant when they visit hospitals and doctors' offices. What should health providers be doing to address this?
Hi, this is Angela. Can I respond to that?
Absolutely.
I think that's what we do when we talk about a patient-centered medical home. So our sites are PCMH certified, which means that the patient is the center of the visit. Everything that we do surrounds the patient. I mean, I know that's probably as old as time when we talk about patients and including patients in their care, but that's one of our primary goals, that from the minute that client walks in the door until the end of the visit, that everything that we do centers around them. It has to be the literacy issues, to the physical layout of the building, to, you know, still, unfortunately, white coat syndrome does happen. It still happens that sometimes just the mere fact of being in an office and having a provider there, folks feel a little intimidated, but just empowering them at each step of the visit to ask the questions, that there's no question that's too big or small. So I just realized from hearing that question again that what we do now in terms of making sure folks have a primary care provider, a patient, and the patient-centered medical home care is most important.
Dr. Jones, did you have something you wanted to add to that?
Yeah, I want to add that one of the things that our Centera commitment is to always listen to our patients. And that's one of the things we tend to do whenever a patient comes in, is that we first listen to what they have to say so that we can better give you the care that you deserve and that you need. So we don't cookie cutter any kind of care that we give. Of course, when we're seeing you coming into the hospital for whatever reason that you present with, but one of the things we will do and we pride ourselves in doing is listening. That's the only way we can begin to start your plan of care, is to listen to what you have to say. So some people, like Angela said, do have that white coat syndrome or have that perception of us not listening, because we're still going to go with what the evidence shows, what the best practice is, or what we need to do to address your care. And it may not be what the patient wants to hear. So while they think we didn't hear them, we heard them. But the care doesn't warrant sometimes what they think we should be doing. But we definitely do listen, and we try and make, you know, address their needs as much as we can. But we do listen.
So I'll add in, Ashley, were you about to jump in? Go for it, go for it.
Yeah, thank you. I just wanted to mention that I think for a lot of Black women, the fear of the healthcare setting and the concern about being discriminated against is real, and it's valid. And a lot of it is rooted in historical things that have happened, you know, across time, such as the founder of gynecology, for example, using enslaved women to just discover new things about gynecology, to force sterilization. There are so many things and so many reasons why Black women would be concerned. So I think first we need to address that and acknowledge that. But then also I think that lawmakers have the ability to do something as well in terms of making sure that implicit bias training is mandated and that it's regular, and that lawmakers are able to recognize their bias, of course, and then that will obviously make a difference in terms of how the care that they provide.
Absolutely, and I'll pick up because you know you mentioned legislators, so I can tell you, like, the experiences of Beyonce and Serena Williams really catapulted this disparity in Black maternal health and Black health outcomes within the pregnancy space. And Judge Glenda Hatchett's daughter-in-law as well, who unfortunately didn't make it through her experience. And so it was the experiences of famous people that helped us get to today, where we're talking about this, where the governor is talking about wiping out the disparity by 2025. We're talking about money being put behind it. So the importance of sharing your story and making sure you're talking about it, because as soon as they started talking about it, you heard, yeah, that kind of happened to me too. Oh, well, my sister-in-law and my cousin, and these community conversations, it was happening a lot, and it was more commonplace for women to feel like they weren't being listened to in these exchanges with their physicians. So in addition to the training for current physicians, what I want to add to this space is also maybe we help people be doctors who don't need to be taught not to be racist or sexist by making sure that there's diversity within all of the fields within maternal health. You know, and so making sure that college affordability is a priority, that, you know, scholarships and tag grants and things that can help more Black women be gynecologists or doulas or whatever it is that is within the work that we're doing, because it would just be great to not need training to say, hey, I'm going to listen to my patient no matter what they look like or where they've been or what they've been through, because they're my patient. And so, you know, shout out to all of the providers that are doing an amazing job listening to their patients. But even in the UVA report, you know, and when I was presenting the resolution about maternal health, there is a statement in there that talks about the existence of systemic racism within this realm. And I got pushback from a delegate that said, well, racism is the thing of the past. Why are we bringing this into this conversation when we're talking about the future? And literally that is not the fight that I thought I was going to have to do right then. So I had to like find my words, and I brought up the UVA report. And I think it came out in 2016. I think the information was from 2014, but it was within this decade that showed that a lot of, or too many white doctors really thought that Black people experience pain differently.
Mm-hmm.
And that's just unfounded. But if you think that somebody experiences pain differently, if they're in pain, you may not take it as seriously, or you may not be listening to the same cues with the same ways, but they're experiencing pain and telling you about it. And that happens in other fields too, where people are, you know, assumed to be pill seeking because of what they look like or how they may present at certain meetings, certain appointments. So it's this, we got to get to the bottom of it, but we have to acknowledge that there's a problem, and then, you know, in order to get through it. So Dr. Romero, if you can, I know that you had an EVMS partner that works with you in data, and can you tell us a little bit more about what EVMS is doing to kind of investigate some of these things?
Yeah, absolutely. So I wanted to also just inform everyone that EVMS just within the past year has actually undergone a strategic planning process that is focused on advancing diversity, equity, and inclusion. And again, with just a lot of situations that occurred over the past, you know, not even the past month, but certainly over the past year, you know, it really highlighted the work that we at EVMS need to do. So just to assure you and give you that sense of hope, that EVMS has really started to look internally at our processes of looking at our admissions committee and assuring that we are being as open and inclusive as possible to any applicant that is coming through our pipeline, and assuring that diversity is a priority, not just in our interviewing process, but in the individuals that we're choosing to interview. We're also looking at internally at our faculty and our staff to assure that we are having diversity, equity, and inclusion considerations anytime that we're trying to bring people into our EVMS family. But I'd say even furthermore, as we, you know, as a relatively young medical school, we're only about 45 years old, we are really in a position to shift and pivot the way we would like to. And one of the things that we've done even over the past 5 years is we have developed a curriculum that is really focused on educating our students, and that just isn't the medical students, but all of our health profession students, to understand and get implicit bias training and to have that be renewed every year, and also to understand the concept of cultural humility, and to understand that we all have our implicit biases, but that in order for us to be the most compassionate, skilled, and caring health professionals of the next generation, we have to be humble ourselves, and we have to be culturally sensitive to everyone that we're serving. So, and then in particular, we have a process that's called community engaged learning that I know I kind of zipped through in my slides, but what we're doing is even in their first year at EVMS, whether they're a medical student, a physician assistant student, or other health profession student, we're engaging them in activities that are side by side serving our community, learning about their circumstances, learning about their challenges, and learning about them as individuals and as people. And so I think as, you know, as we continue to learn from these experiences and try to find the best way to support our students to really take on that humble, you know, approach, then I think you're right, Delegate Price, that at some point we're not going to have to worry about this, but we've got a lot of work to do. We've got, you know, the people that are currently in the positions of leadership and currently, you know, practicing physicians, but we also have to address the pipeline. And I think EVMS is really, you know, leading the pack in terms of saying, we haven't done this right. We have to learn from the current circumstances and figure out the best way and continue to learn based on the feedback from the people we're serving.
All right, so I think the next and the last question that I have is, what are some of the top misconceptions or myths about pregnancy that you want to dispel?
So I'll say this is Angela, and I think this still rings true, that if you're a multip or you've had several children, you don't need to enter into prenatal care early or within the first trimester.
One that I hear often is that you don't need to learn how to be, well, this is more about parenting, but you don't need to learn how to be a parent because you're born with the information. And I can tell you that that is not true, because I don't have any kids and I would not know what to do. But a lot of the parents that my mom has worked with, she actually taught tips on parenting with her business, the Get Up Project. And it was just, there's new information, there's new things that you need to be doing, things are changing all the time. So it is okay to not know something and to seek out the answers to your question.
I'll just add to that. So often when we do a prenatal screen and then we get talking about resources in the community, women are shocked. They had no idea, even if this is their second, third pregnancy, of the resources that are out there and things that are available to them. They just were never made aware of it or just didn't know. And they always appreciate the fact that we've shared that information with them.
Well, awesome. Thank you all so much. So I do want to give an opportunity. We have covered a lot of information this evening. So give everyone the opportunity to just offer just a few summary points. If you want to repeat something that you said, to just uplift it. If there's an event that you have coming up or something that people need to know before we end as we're coming to the close of the program. And I'll just start with my Hollywood squares here. And let's start with you, Dr. Romero.
Sure. Again, Delegate Price, thank you so much. And again, thank you all for your words of wisdom. I just want to say for the general public out there that, you know, if you're thinking about getting pregnant or you're pregnant now, please be sure to just get checked out. And again, like you've heard on this webinar, seek the care of your primary care physician and certainly with your OBGYN once you do get pregnant, because oftentimes there are medical conditions that you may not know that you have that may actually put you at higher risk during your pregnancy. And oftentimes the sooner we know about those medical conditions, the better. And please know that we are all trying to help make the system more better, more welcoming, and just more supportive of you. So please be patient with us as we continue to try to help make things better for the entire Commonwealth of Virginia. So thank you all.
Michelle?
Thank you again, Delegate Price, for putting this together. I just want to say, you know, this is real. Black maternal health is real. The racial disparities Black women face seeking maternal health care is very real. And your story is valid. If you do have a story, please know that, you know, even if you haven't told it, that it's valid, it is real. And, you know, I'm so happy to be amongst this group of folks who want to build this community and build a support system for folks across Hampton Roads. So thank you so much for that, everyone on the call. And like I said, if you would like to reach out and volunteer with us, please do. We do have events coming up, but also this is an issue that is very near and dear to my heart as someone who's hoping to be a parent soon. And I really believe that if we come together and we really work together as a community, we can really start to see some really great things happen in this issue. So thank you guys so much.
Awesome. Ashley?
Yes, thank you so much, Delegate Price, for having me, and Tempest as well for organizing this really important conversation. I will just say that now is the time to advocate and to speak to your legislators prior to the special session. It's just a couple weeks away. So it's really important to remember that you have a voice, and your voice is important. And lawmakers are people just like us. Delegate Price is a person just like us. They want to hear from you, and they need to hear from you. So if this issue is important to you, I highly recommend that you contact them prior to the special session.
Absolutely. Becky?
Well, I would like to dovetail along with what Ashley just said, but I've also been thinking that women who are pregnant, who want to become pregnant, this is your body. You have a responsibility for making decisions along with your provider all through the pregnancy. It is up to you to be in charge of that process.
Absolutely. And Jenny?
Well, I'd like to ditto pretty much everything everybody said, but I just think that prenatal maternal health is so important. Having a healthy mom simply leads to a healthier baby, and these babies are our future. And I think we need to make sure we invest early on in maternal health so that we're going to have healthy leaders in the future.
Yes, and Ms. Futrell?
Hi, thank you again, Delegate Price, for the invite. And Tempest, thank you for hunting me down. Next time I won't be so difficult, hopefully. But I am getting on up in my years, so I'll put it on my age. But again, thank you for the opportunity. I guess my closing comments would be just that everyone needs a primary care home, and you need a primary care provider. It is often your family doctor or your primary care provider, whoever you want to call them, that will confirm the pregnancy. So you need to have someone that you feel comfortable with, who cares for you in wellness and illness, and then puts you on the right path to solid prenatal care. And not having insurance or being uninsured or underinsured is no reason not to have a primary care home. That's what we're here for. So those are my closing comments. You need a doc. Everybody needs a doc.
Absolutely. And I would just co-sign all of that. And we are going to be sending out this recording and some links and contact phone numbers and all of that. So if you are not already subscribed to receive our newsletter, we're going to drop the link for that, but it's delegatemarciaprice.com. So make sure that you get that. We're also going to be sending out some information from our town hall from last week on tenants' rights and responsibilities and preventing evictions during the pandemic and in general. So be sure to sign up because those newsletters are coming out. I want to reiterate the importance of sharing your story and your experience. You know, we can look at data and charts all day, but like they said, legislators are people. When we hear those stories, that's what really makes the information stick. When I hear my sister-in-law talking about when, you know, my nephew was born, and that stays with me every time we have a maternal health conversation. And it really just makes it poignant about how urgent and important this issue is. Continue to work to end the stigma of needing help and needing to get answers to your questions. No one was born with all of the answers, period. Period. You're reading books, you're asking questions, and that I think is really going to add to the experience and also normalize some of the things that you might be experiencing that might feel weird but are actually completely normal. Or if there's something that's not normal that might be a red flag of an issue, letting you know that it might be time to go get that checked as well. And then just understanding that pregnant people are people. We need you to do everything, just like Ms. Futrell said, do everything that it takes for you to have a healthy mind, body, and spirit as an individual. And you'll be a better parent once the baby gets here, after having taken care of yourself, and really be a great role model, so that we can end some of this generational stigma of, especially around mental health, like baby blues and some of the things that happen, postpartum depression. Those are also real. And so we want to release the stigma from that, so that people can get the help throughout their life, but especially right now, as we're talking about maternal health, to take care of themselves. And that is all that I have. I want to again thank these wonderful women who are really making a difference in our local community. Stay tuned. We are going to have a conversation on Instagram Live with some doulas, so that we can talk more about what they do and why it's important, and resources that are available from that end. And so this was our contribution to the conversation for the first Maternal Health Awareness Month in Virginia. And we look forward to bringing you more things as we're going to continue the conversation as a roundtable. If you are a practitioner or you're working within the realm of maternal health and you want to be a part of the roundtable, we welcome you. We welcome your voice. Please reach out to my office so that we can get you connected. Again, thank you all so much. This has been a really enlightening conversation, and we'll get you that email once you subscribe at delegatemarciaprice.com. Take care. Have a good evening.